If you have ever worried about taking the COVID-19 vaccine before or shortly after surgery, this edition of the Health Report is for you. Here's Shamela Pullen.
So you have an upcoming surgery and you want to get vaccinated before or after. Is it safe? This question is becoming quite common, according to head of the surgery department at the Kingston Public Hospital, Dr. Lindbergh Simpson.
As with everything else with COVID, a lot of the information is just coming to the surface, but by and large, our best available evidence says that so far with the vaccines which have been most popularly studied, the AstraZeneca, which we've given here in Jamaica, the Pfizer, the Moderna, and the Johnson & Johnson, there seem to be no significant interactions between having had the vaccine and having had the surgery. In other words, surgery itself is unlikely to affect your response to the vaccine, and you're not likely to be worse off having surgery after the vaccine.
But there are guidelines. Dr. Simpson recommends, among other things, taking the vaccine at least 7 days before surgery.
Patients who have a vaccine can have common side effects like a fever or muscle weakness. And if at the same time, if you do the surgery 2 to 3 days, it may be difficult to say, is this an issue with the surgery? Is this a complication of surgery, or is this a vaccine-related complication, which usually most of the vaccine-related complications are self-limiting, minor, will go away with just Panadol. Whereas if it were a complication of the surgery, then the surgeon might be more inclined to do some kind of test to make sure everything is okay.
Dr. Simpson says getting the COVID vaccine is critical at this time, and so it should be a priority.
And in light of the COVID-19 situation and the scarcity of vaccines, I tend to tell my patients, if it's a procedure that can wait and you're able to schedule your vaccine appointment, keep that, because it's often easier to get, to wait 7 days and reschedule your surgery for another week or two. If it's something that can wait, then maybe getting into the line for vaccines, because we still know that, there's still demand is greater than supply, certainly locally at this time.
The doctor also notes that someone who is fully immunized against COVID-19 and who contracts the virus after is less likely to develop major complications during surgery. With her health report, I'm Shamela Pullen wishing you good health.